Hello again. It is another Down Fracture podcast, a podcast for talking jaws. Dr. Michael Watson from Arizona Jaw Surgery here with Dr. Sam Bobek from Seattle Jaw Surgery. Sam, what's up?
Not much, man. We had some Arizona weather here in Seattle this weekend. It was 90 degrees, and all of us, Northwest people were on the edge of heat exhaustion. So I'm happy to be back indoors with air conditioning. How are you doing,
Did
man?
your house have air conditioning?
No. I mean, what do we have? You know what it's like up here.
Yeah.
4 or 5 days of hot weather a year. It's doesn't seem.
Man, we were fortunate when we bought our house up there. It was being built brand new, and like we didn't design it or build it, but like we put an offer on a new housing subdivision that was being built, and we were able to add that, and it I do not regret it at all.
I mean, it would be nice. And every year, like on those few days, it comes up. But
I mean, it's not uncommon to have, weeks of 80 degrees, 80 plus degrees, and it's daylight in the summer for so long that it takes a while to cool off, and you're trying to go to sleep and it's hot inside. And
yeah, it's just we got a basement. There's trees over our house, so it's not too bad. Anyway, one day I'll make the change. It's not like a mandatory thing. Like in Phoenix, you have to have it, right? Like
oh
there's not
man,
houses that don't have air conditioning.
we have three air conditioners.
That
What do
seems
you
a
think?
lot.
What do you think about that?
That's seems excessive, but well, yeah, well, sweet. Well, yeah, it's good. We're back on normal schedule. We are talking about social media today, right?
Yeah, I think that was the plan. I guess our general basic housekeeping is downfracturepodcast at gmail.com for any topics, submissions, questions, concerns, ridicule, especially if it's directed towards Sam, is always appreciated.
Yeah.
Yeah, I think talking about social media is a good topic, and I think before getting into it, I think just reminding the world or whoever listens to this that our audience is mostly other surgeons or other providers, practitioners, or whatever you want to call it, and not necessarily geared to the patient perspective of this per se, but I guess we'll kind of hit on a lot of different things. So, is this I'm going to assume the answer to this is yes, but is this a ongoing issue or an ongoing thing that you have to deal with or address in your practice?
Well, sure. I mean, I think most people do. I would have to believe that the people who do a good bit of jaw surgery that are listening to this are familiar with this topic. I just think that there's different aspects to it, and I'm I am hoping that it improves as time goes on, because there's kind of benefits and risks to all of this, both on the practitioner side, but also on the patient side. So,
Definitely. Yeah, I
um,
mean, I think there are some positive aspects, and maybe that's the best place to start is, I think in my experience, and I'd love to hear yours and emails from other people as well, is I feel like the quote unquote support group aspect or the support aspect of it can be helpful. I mean, I have had patients who have said things like, as we're going through, pre-surgical meetings and consultations of like, hey, here's what I think you should expect. Here's what I think is concerning. And they will say things like, yeah, I've seen that from other people. And I've even reached out to other people who've had surgery and talked to them. And so I kind of feel like I have a reasonable grasp of what to expect. And even post-op, they said, I was worried about this and this. And then I remember talking to a couple other people who'd had surgery and they told me they went through something similar. So I think it can have some very positive aspects when it comes from a place of support. It's some of the other aspects that I think tend to have a negative, uh, you know, kind of
yeah,
turn
well,
things.
I mean, because I'm older than you, right? That's correct.
Not
Not
even
like
close.
dramatically, but like a little bit.
I mean, you're looking at our faces right now. Is that a serious question?
Uh, uh, um, because I feel like jaw surgery practice with social media and just kind of like provider care with social media, like I remember life before this. And I remember life growing up in college and that sort of thing. Because I mean, when I was going to college is kind of when the Facebook started. And it didn't really get going for a while. And so my personal experience with social media, and then also my professional personal experience with social media, is that I've kind of like seen the transition in times. In your life, have you just always had that sort of thing?
No, I was similar to you. It was my sophomore year of college when, and I love that you called it the Facebook,
It was that,
because
right? Isn't
that
that
was
the
the
name of it?
original name. Yeah,
Yeah.
that's why I say I like it. Yeah, it was my sophomore year of college when the Facebook came out, and you had to have a .edu email address to be able to even get on to Facebook.
Yep.
And I was actually, to my roommate's dismay, I was the one who was like resistant to it. At the time, I was like, this is kind of silly, stupid. You don't need to be becoming friends with someone, yada, 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 and posting all these pictures. It's kind of weird. But yeah, it has been an interesting transition. But I remember it from a professional standpoint of it mostly being, if you even want to consider it that, and I don't know that I would, but Google reviews and Yelp, I don't consider that social media, but that was kind of the quote unquote online presence that you had to navigate and deal with. And now with true social media, it's a different level altogether.
Well, yeah, I mean, certainly on the practice side of things, it's been what's been nice about social media has been helping patients understand things, networking with other patients that have had surgeries. Because before all of that, you would get the question, "Hey, do you have a few patients that I could reach out to?
Absolutely.
Where do I go to get more information?" And you give them brochures or maybe some practice paperwork that you have, but all of it's a bit generic. And so I don't know. I remember along the way, one of the bigger Facebook groups got going, and it was what you described, in that patients could reach out and talk to other people who had been that through that sort of thing. Because it seems like initially people would post just like blogs or experience of themselves online, and as kind of the different media has changed, it's now to people are just posting their TikTok videos and whatever their Reddit experiences, those sort of things. um and I think initially what was kind of helpful in terms of getting information can sometimes be harmful in that you're getting a bunch of information that may not apply. So I think
But I
it's like
think
striking that balance is hard.
very much so. And I would add to that same thought is it's not always comparing apples to apples, right? Like even some of the patients that I've known who have really taken the time to learn things and educate themselves and, listen to what we tell them. There's still like they maybe don't understand some of the nuance of like, okay, well, you had a three-piece Lafort versus you had a single piece, or you had a chin, or we had to take out turbinates on you. Like there's nuance to things where then they start comparing what they're going through and experiencing. And there's even that almost like comparing surgeons of like, hey, so and so had this experience and had this surgeon, and this one is different because I'm with Dr. So and so. And it's like, well, you're not like, we didn't both treat the same case. And for better or worse, there's some nuance to that I think that goes overlooked. And then there becomes this tendency seemingly to become a self-fulfilling prophecy of Dr. So-and-so's patients have more swelling, or I mean, I try not to look at it too much anymore. And this is just all like what patients tell me now. And so I think there's sometimes some stuff that's lost in translation to this, that
Well,
happens and reverberates.
yeah, I mean, I think, and I've thought about this a bit, and I'd like to hear your take on this, but my perception of how social media impacts is a little bit different than someone who's just grew up with it, right? Like people who are now our patients would have just had social media as like it's always been there, and it's a place they go to get information. And if that's the spot where you go to get information, it would make sense that that's where you build your information, and then you go off to find practitioners based off of what you find on there. Whereas in the past, it was, it was a bit more word of mouth. It was a bit more, the professional filled in the information in terms of information gaps. Now, it's honestly, you ask Chat GPT, or you ask AI, or you ask a Facebook forum, or you ask Reddit or something of that nature, and people start giving opinions, and those people aren't professionals, right? They may have had experience, they may not have had experience. And it's on the professional side, getting into a conversation that the patient may have already had a bunch of conversations about it, right? Like it's different when they've had different professional opinions, go to see different surgeons versus, people weigh in online. And it's that I think it's a little bit hard to get accustomed to. And so new practitioners that are coming out, I think, um, may not be aware of this whole phenomenon of patients posting pictures or posting their x-rays, and getting a lot of opinions from people. There's definitely, to me, it borders on practicing medicine. And in a lot of ways, it seems like this would be an area that would benefit from a bit of regulation. Not that I'm a huge fan of more regulation, but I do think there's some safety issues of people that are, they want to get information and they're otherwise well-meaning. They're getting their questions answered by people who, aren't necessarily certified to practice medicine. And you know what I mean? Like
100%, I know what you mean.
it's one thing to ask your family member, what should I do with some swelling, or, what do you think about this, versus asking online forums and them telling you, yes, you should take this medicine. No, you shouldn't do this thing. Um, you should get second opinions for these other things. It's difficult when it comes to that, I think.
No, no doubt. What I would phrase it as, what I encounter at times that can be challenging, or how I view it maybe is, I think it is very reasonable to, in a forum of people who have had either similar experiences or experiences you're about to undergo, or have similar conditions, to go to them and get information, get input, support, etc. But where I think it becomes a problem, or I would even say, and then if you take that information back to your actual provider in the form of questions, concerns preoperatively, wanting that person's input. Because I mean, look, here's the reality. Sometimes you go to appointments in the medical world and you don't know what you don't know. So you don't know what to ask. You
Yeah.
don't know what you should be thinking about. You don't know what concerns there are, and you don't want to go through it and then suddenly have to deal with those things unplanned. So when you utilize tools for what they are, generally, I think you can have good outcomes. So if you utilize it as a, hey, what questions should I be asking? Or what concerns did you have that you didn't expect? And then you take that information that you get from the online community and you bring it to your provider to have a discussion. I think that can not only be reasonable, I think that can be helpful.
Yeah, totally.
But when you take it to the next level of now me as the provider or you as the provider, now when it becomes a battle or a competition of who are you listening to more and who are you trusting more, that's where I've had some issues is, I would frame it in the sense that most of us have a way of doing things and we kind of know what to expect. And when patients or circumstances deviate from that, it really muddies the waters. Uh, and that's where I think it can be harmful
Yeah.
at
And I
times.
mean, I think on, let's say, hypothetical group on Facebook, let's say, that has, a reference to whatever jaw related topic, right? Like sleep apnea, condylar resorption, just whatever it is. I think providers understand, especially providers who do a good bit of this, is that there's regional differences to practice, and that exists for a lot of different reasons. Training, insurance, just kind of preference, those sort of things. But in a forum, it glosses over those regional differences, right? Like how um let's say condylar absorption is managed in, let's say Toronto is different in Miami versus Paris versus LA, right? And it isn't that one of those is right, it's that there's uncertainty to what's the right answer. And I think understanding the gray area and understanding the clinical kind of relevance is why you go meet with a professional about these things, right? And I think that's kind of an important aspect of this, is there's a good bit of unknown, right? So
And
uh,
I would even throw out, similar vein margin of error with some of this stuff. I think that that's glossed over of like, we're all kind of doing the best we can. And if you're, you know, it's all got a little variability and wiggle to it.
sure. Yeah, but I mean, I think that on the we want people to be educated, we want people to do well. I think social media in terms of networking for professionals is great. I think in terms of like keeping people up to things and um I don't know, like our format here, I think it's nice to be able to kind of just talk openly about some of these topics. I think to me the biggest trouble it seems though is anxiety. So I think social media from my view, and it could be that I'm in the Northwest where anxiety is more common, but it seems to have a increase in anxiety. So what do you think about that?
Yeah, I think so too. The other variable that I sometimes deal with is maybe, I don't know the best way to frame it, but maybe unrealistic expectations is a way to say it. And I can't remember, I think it was you who's utilized this analogy before of jaw surgery, TMJ surgery, some of this stuff. It's not like ordering a meal. You're not picking your meal and your sides and your dessert like, and I think people sometimes do treat it that way of like, hey, I want this, 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 and this. And it's kind of like some of those run against one another.
Yep.
We do the best we can. You need to maybe, if you want those things, can you rank them in order of priority for me? Because some of those things really, truly run 180 degrees in difference from one another. And it's going to be difficult to achieve all that you want to achieve unless, you want to go way overboard and maybe we're doing facial implants and other things along with it. I think sometimes there's just that, like, I want everything to be perfect without realizing like how imperfect we all are. And I think that sometimes I would even turn around. I would say that sometimes gives me anxiety on top of their anxiety.
Well, because that's the thing. I actually think that because when you're anxious, one of the solutions to that is having control, right? Like you want to have control of the situation so you don't
No
feel
doubt.
anxious anymore. I mean, that's just, human nature when it comes to that. And being comfortable with the gray area through all this is, frankly, one of the scary things of practicing in this world, right? Like as you realize once you get done with fellowship or residency, you get off into the real world, you can kind of see some of the things that you thought were very black and white aren't that way. And kind of managing that as you get into practice is important. And the same side on the patients, right? Like and I haven't been a jaw surgery patient, but I've been a patient for other things. But I see it that when you kind of get closer to the time of surgery, you want to kind of get in the details of how this is going to go. And it can be, uncomfortable finding out that there's wiggle room to this. Like, wait, I we're doing this for, airway. I want my airway to be fixed. And it's like, well, it's unfortunately not 100% thing. And kind of seeking out information to assist in that process makes sense in that way, right? Like, well, maybe we could make this better, which I share that interest, by the way. I think that's great. It's just as things are currently, there's too much human variation to really account for with our current level of knowledge. So, I mean, I think it's anxiety. I mean, I definitely we were talking before this. Literature is catching up to us on this stuff, right? Like it's catching up to practice. This year, and I can't remember the month, in Journal of Oral Maxillofacial Surgery, they had a paper on wisdom teeth and patients' experience with anxiety if they engaged with social media before surgery or they didn't engage with social media. It ended up being that they were more anxious if they sought out social media, and they broke it down. I have it actually pulled up. It's Kalkin and Talty, I think are the last names. But anyway, just looking to JOMS this year, um, they looked into the types of media that you have posted up on, the PowerPoint here, but also the different techniques like just written versus video versus pictures. And it looked like video was caused the most anxiety with
Hmm.
surgery. And, that's just wisdom teeth. With jaw surgery or TMJ surgery, uh, even, more complicated things like joint replacement or revision jaw surgery. Um, I think it's true. I think the more information, the more anxiety, unfortunately. So I think to me, like managing that and understanding it is an important aspect of care.
Yeah, it's tough. So I mean, that's the issue, right? How do you solve that problem? What do you tell the patients? Hey, stop looking at social media. Yeah, that's probably only going to make them look at it more. Um,
No, I don't think so. I mean, I think it's more just like understanding on the practitioner side. For me, at least, I'm trying to engage with social media just to try to understand it a little bit better because I'm a little bit behind the times when it comes to that sort of thing. Um, I think that part of the reason why there's some disinformation or misinformation out there is there's a lack of good information being produced. Um, because I mean, senior surgeons are producing information in papers or they're talking at conferences, and I think the volume of the the messages being sent in media may not be coming from the best messengers, let's say. So, and that's on the practitioner side, right? I mean, you follow that stuff better than I do, and you've been after that. What do you think about that?
I mean, I definitely think there are some people who have done a very good job of marketing or utilizing social media to advance their practice, maybe without truly accurate, genuine information or intentions. Is that what you're getting at?
Well, I mean, it's just my impression of who's kind of loudest voices on social media when it comes to jaw surgery may not be my impression of who the best people are to go see for jaw surgery. Not
Agreed.
not hating on any individual, just
Right.
I hold some people to high regard in terms of their experience, and um my understanding thus far is those guys are not, or ladies aren't well represented in social media. So um and I mean I think an argument to that would be to improve that, right? Like
Yeah, if possible. I mean, I think that's a tough battle, and I think that kind of goes along with what we're talking about is some of the information comes from these places, and then when you contradict or have a different take on some of this, you're almost, I feel some people are like skeptical of you, you know?
yeah, I mean, let's just throw out a common one that comes up nowadays, which is minimally invasive orthognathic surgery, right? Like minimally invasive, that's a relatively new one. It feels like it's the new wave of um what people are asking about, which you've seen a lot of waves at this point, right?
Yeah.
Yeah, okay. So it's like some new topic comes up and people are very interested in it, get a lot of questions, and it seems like there's a lot of posting and in that sort of thing. When the data behind that and certainly the reasoning behind it, I don't fully understand as someone who's kind of practicing in this world. Like I always want to get things better. I want to kind of improve patient experience and outcomes. I'm unclear on what problem we're solving with that whole process. But it has the focus, and I think part of that's just the lack of the message, the good messages being sent out, right? So I think for those listeners who may not have as much social media representation or kind of have someone else do it, I would hope that the people out there that are doing a lot of jaw surgery kind of get the good word out about, kind of how things are. And that way people can get access to good information.
Yeah. I mean, I think the one that I thought you were going to say and that I hear more of. I hear that one sporadically. The one I mostly hear is custom hardware, and things like that. And I think that's the battle. That's the one that I deal with more on
Yeah, I
my.
mean, custom hardware is, I mean, I I get the impression that people don't understand that plating companies make significantly more money with custom hardware. And
And someone's paying that.
it's sales, right? Like you're being sold things. It's a drug company ad. And I feel like with custom hardware, uh it's being pushed by people who have financial interest in that sort of thing. And
Or marketing interested from a provider perspective. I mean, again, that's the one that I see a lot of is, and then people come in and when you try to explain it to them, some people are receptive. It's like, hey, I try to tell them I do use custom hardware in certain circumstances. I feel like it's either needed or beneficial, but to use it on every case is kind of a is wasteful,
yeah, and I know we've talked about
monetarily.
kind of pros and cons of custom hardware, but
Yeah, but we
it,
don't need to go into details, but I think that's where, from a social media perspective, when you start going against the grain, so to speak, of the loudest voices out there, sometimes people are receptive to it, and sometimes people again trust the social media more. And that's kind of the issue of who does the patient trust more? Uh, and
yeah,
that's
and I mean, it's gonna have to strike a balance to some extent. I think with custom hardware is a good example of something that is maybe not clearly financially driven in terms of the reasoning behind it, but that should be clear. Like I I feel like the increase in cost is totally glossed over with custom hardware. I mean, it is. I mean, it depends on the contracts, but it's at least $5,000 more dollars in Arch, like at least versus just stock hardware. And the customization of surgery is more interesting in customizing the bony cuts and the amount of advancement and whether or not we're widening both arches or one arch or you know what I mean? Like that's
yeah.
more interesting.
I
It's just
again
not driven
from a
by a company.
and from a patient perspective, the things that I would be interested in is in this specific topic that I think is glossed over and is an example of how social media can shape opinions is one, cost. Is this going to cost me more? And often it's a cost that's hidden within hospital and insurance bills, so they don't necessarily tangibly feel it. Even if they are paying more, they may not recognize it. Or I don't even know, some cases they may not actually, the patient themselves may not see much more of the cost. But I would also, maybe this sounds, I don't know, a good way to say that, but I would have reservations over I'm seeing a surgeon who needs that every time. And that would give me, I mean, I could see that going both ways of like, okay, this person uses custom hardware every time, so they're probably getting accurate results. But it's also kind of like, what happens if things don't go well during the case or something doesn't fit? And this person is reliant upon these things, whereas someone who does both or doesn't necessarily lean on that, I would maybe have a little more confidence in. But maybe that's a personal bias of mine of someone who doesn't utilize it all the time. But I feel like you're looking at someone who's in theory leaning on some crutches consistently. Maybe that's just again me. I
Yeah,
don't.
I mean, in a lot of ways, I think the custom hardware, I think about like when virtual planning came about. Remember virtual planning when it started? It was like, well, you don't need this every case. Like just the most complicated things. Yeah, I can see it, but it's just like too much cost. And our current things are accurate enough. And so I hear that kind of discussion kind of echoing in the 3D or the custom hardware side of things. It's just that cost is huge. And all of us as practitioners have, an ethical responsibility to minimize cost. And increasing costs at the hospital, increasing costs for payers is it makes sense if there's good outcome behind it, right? But I
Yeah, we're
don't know of
getting.
any outcomes that are better there.
I mean, I've seen some reports where, I think the often cited, margin of error with traditional jaw surgery is like 1 to 2 millimeters. And I think I've seen it like about 1 millimeter or slightly under for custom hardware. I've seen some papers out there. I couldn't quote them to you, but
Yeah, but I mean, in a lot of ways, inaccuracies is somewhat of a feature of it, right? I mean, because how much do you impact a maxilla when you advance it? How much do you really need to move the chin at the end of the case? You know what I mean? Like how
Mhm.
seated are the condyles? There's inaccuracy to the plan that's kind of helpful. Some situations it's not helpful. Other situations it's nice to be able to adjust during the surgery. So,
Yeah,
but like
we're
that
getting off topic.
nuance, yeah, exactly. We're getting off topic. That nuance isn't really brought out by social media posts when it comes to that. So, I think
Yeah,
it's important.
absolutely.
Yeah,
What
for
about I've gone through, you mentioned the word waves earlier, and I would say that's when I first started this practice, I tried to get on social media from a helpful perspective. Like, can I join some of these groups and provide a benefit to patients?
yeah,
To similar to what you're saying is like, can we get good information out there?
yeah.
Um, can- I feel like that's in the beginning I had good intentions, and then I just kept seeing so much stuff that I was just like, I can't handle this. I don't need to be on this every day or every few days. And it became, I think, a negative experience. But one of the things that kind of turned me off to doing that, and why I try not to look at it anymore, is I feel like there's we're just creating or perpetuating or striking the match that's igniting just an increase in body dysmorphia. Do you see that? Do you feel that? Like, I mean, I have patients come to me with aesthetic things, and I'm like, you are a good looking person. Like most people walking through my door, their goal is to look like you do right now. And we're really like, I feel like as a society, we're headed that direction, and I feel like social media is a big part of that. Do you
Well,
see
sure.
that?
Yeah, I mean, because what's getting posted may not be a true representation of what's happening, right? On either way, on the positive or negative, right? So if someone's posting postoperative results and um, it may not be representing what actually occurred, how would you know that, right? Like, how would you know? And then
You wouldn't.
um, the
You know,
advice you're receiving, you don't really know how much that is in the context of what you're undergoing. And so very, very much, I think it's all of our, and we understand, I feel like most people who do jaw surgery understand this, but understand that, saying no and trying to not overtreat and understanding the clinical situation of why we're doing it is really important. Because I mean, things like dysmorphia only worsen with all this. I mean,
no doubt.
because especially if you engage online, because then you have other people weighing in on it, and it's imperfection is just kind of like the human condition, and seeking something other than that is, I don't think, can
That's
be
uh
found.
that's what I'm speaking to is like people would post photos who have like normal occlusions, they don't have sleep apnea, they don't have functional problems, and they're like, do I need jaw surgery? And like some people are like just ripping them to shreds. Like, yeah, your jaw is recessed. You look like your neck's trying to swallow your face. Like it's just really negative a lot of times. And then to be fair, some people are positive and they're like, well, look, I mean, you're a good looking person. So it's almost like the people posting it, like, what are your goals? Like, I guess maybe that's a generational thing too. You talked about we grew up in ages where this wasn't the norm and it wasn't just part of your life. Like, I couldn't imagine just taking a photo of myself and being like, here, world, like, rip me to shreds. Or, am I seeking validation? Like, oh, no, you're good looking. And it's like, oh, phew, good. I needed that validation. Or like people are ripping you to shreds. And it's
I mean,
like,
I have an opinion on this generally, which is probably, I feel like, getting a little bit off topic on the the need for social media, but it does feel like social media creates communities for people when they should have communities in real life. Because
oh, no
communities in
doubt.
real life are real people and tangible, and you have real feedback mechanisms that help out with anxiety, by the way. Like, I feel like I've part read a book. I got turned off by it, turned it into a little too scientific reading for my spare time, but it was about the demise of bowling leagues. I forgot the name of the book, but it had to do with just as time has gone on, how people aren't just like meeting up in real life to hang out and bowl in the evening. Same would be true with whatever, like baseball leagues or softball leagues.
Happy hours. There's an article on people not meeting up for happy hours anymore recently, I read.
Yeah, and it's because they're engaging on their phones, right? And the lack of real world connection kind of is in some ways caused by your ability to connect online. And the difference in those two connections can lead to, like loneliness and uh, loss of support, which gives you more anxiety. And I feel like these are just, other problems that exist in community. But in jaw surgery world, it does play a role.
No
Because
doubt.
I mean, I've seen it. It's people have a hard time post-op if they're engaging with the online community for support because it is an up and down process, like swelling and bruising and the uncertainty, like, am I healing right? Am I not healing right? Like you can get lost with that. And it can really get in people's way in terms of their wellness. And so having tangible humans to help them out is a lot of ways best. And so I would say that feeling out people in terms of who they have for support and engaging them in the support process is important. Like pre-op, getting family in there,
Absolutely.
it is important. So
Yeah, we always try to we make a point, and I'm sure most people in this world, in the jaw surgery world, do that too. We always try to whoever's going to be helping take care of you after surgery, if they can come to the pre-op visit, we recommend that every single time. I think that's helpful. Have the message be combined. But yeah, I mean, I don't know. I mean, I think you think this is going to get better, or you think this is going to get worse?
I don't know. I think it's probably better. I mean, uh, I don't really know. I have a teenager, so I kind of watch him use social media and kind of how it's going about. Um, Still, I can't tell on any individual. It seems like with the arc of practice in the last, let's say, 5 years versus 10 years ago, social media is definitely a big deal. And it's I think understanding on the practitioner side is important for us old people, but also for kind of new practitioners coming into it, right? So I think
I think so, but I think they're just better equipped to handle it. Like you're saying, I think the generational, this they're just used to dealing with it, maybe better than we are. I don't know. Maybe I'm wrong.
yeah, but I mean, I think when you learn jaw surgery as a resident, it's going to be different than when you get out in real life. So it's just different patient populations. So,
No doubt.
um, I think we didn't talk enough on practitioners and kind of continuing education and that sort of thing from
What
social
do you
media.
mean?
Um,
You mean like us as practitioners posting cases, experiences?
yeah, like interacting with each other on it. I feel like because I don't know about you, one of the main areas that I get information on my TMJ side is the intergroup,
Hmm.
the email intergroup that people don't know about this. If you I actually don't know the mechanism, but I think it's you have to do a certain volume of TMJ replacement and you are invited or it's brought up that you can be part of this email group to get information. You basically just get studies and it's a good resource to find
Yeah.
out pertinent literature when it comes to this stuff. I think there's similar things in terms of blog posts that are out there. In some ways, like our discussion is this, but um, I think social media to kind of keep up with literature and to engage in the community of surgeons, I think there's a lot of room for that.
It'd be nice. I mean, I think we all have reservations. I mean, for me, what I would actually like to post is often like tough cases and even complications. Like, but I think you got to be leery of what you post online because it's hard to restrict access to it and it's
Yeah,
hard
I
to
mean,
restrict
definitely,
interpretation.
yeah, HIPAA restrictions on providers versus no restrictions on the patient side. It's kind of like the same as reviews, right?
Well,
But
yeah, I mean, I would just also, I mean, just say like, what would, us as who do a lot of this, what do we learn the most from? Like, if message me or send me some information or we talk and it's like, man, I had this tough case, I had this tough circumstance, here's what I did, or I got this bad split. Like, I mean, that's what I would learn from. And I think if you post that online and it's open to the world, uh, same thing we're talking about where the interpretation of that information, certain aspects are glossed over or not realized. Like I think you're putting yourself out there potentially and you're trying to do it. I would be trying to do it as a positive, like, hey, I had this circumstance. I would like to share it so that my fellow surgeons maybe can do a better job next time or have this information. But if you post it to social media, so and so's a hack, or Watson gets complications all the time.
Well, I mean, it is hard to split up, what's professional discussion versus, what's like, provider discussion versus like provider patient discussion. Because I mean, we just kind of discuss things at a different level. Like, our discussions here are, I think, more geared towards practitioners. And so we talk about it as if, people understand kind of the background to it. And so I think coming from a place of not being a practitioner, I'd have to believe some of the messages would be different than what we're trying to convey. But nevertheless, I think engaging social media on the provider side, I think is something that I just don't think there's as many resources. So, but I think for people getting information online, especially younger generations, that there'd be a need for that, right? I mean, could be that things like custom hardware are interesting to new practitioners because they just don't understand, they don't hear the alternative message, right? Like, so I I think getting good messages out there is important, and I like the engaging of community, even though I do get concerned about the lack of real world community frequently. So
Yeah, I hear you. Well, you got anything else you want to add?
I don't think so. I mean, this is always a tough topic because I don't want to get myself in trouble. Like I don't want to offend people when it comes to social media, and I don't come across like I'm some old guy that doesn't get it. Because I am an old guy that doesn't get it, but I do practice in the world of this, and I haven't found it a spot that I definitely have to turn it off, right? Like I think what you said in terms of reading it and engaging and posting messages and all that sort of thing, there's got to be a separation between your time off work and time on work, and engaging that stuff at nighttime and on the weekend, and you just got to turn your work mind off. So from provider wellness standpoint, I would maybe just use it as a provider discussion. I think jumping into those forums, uh you're going to spend a little bit more time there than you want. So I think
Yeah,
I personally don't spend any time on them. So
I don't anymore. Again, it's one of those things where I felt like I had good intentions and I was like, okay, I'm going to try to, exactly as we've talked about, there's a lot of negative. Let me see if I can be some positive. And it does
because
not turn out that it's certainly not positive for me.
I look forward to us talking about provider wellness one day, but on the provider wellness side, getting away from this work and these topics, when your phone's there and it's got all this information and messaging, and that can always pull you away, like get to your kid's volleyball game, or like softball or concert, and be disengaged from this world that tries to suck you in. So
It does.
um I think that'll be for another discussion, but I think the social media thing, it'd be interesting to hear people's input, and if they have some tidbits for me or for us, that'd be great.
All right, cool. Well, that was a another Downfracture podcast, a podcast for talking jaws. Downfracturepodcast at gmail.com. Please let us know your thoughts and how bad of a job we did. But again, your complaints only go so far unless you're contributing
We'll
to
just keep
this
posting.
free but spectacular podcast in some way. Um, well, I guess we'll wrap it up from there. I'll see you next week.
All right, sounds good, man.
All right, see ya.
Yeah.
Bye.